Hello friends, welcome back to Complete Medical Coding. Today I'm here with some important guidelines and practice questions from the cardiovascular system. Okay, cardiovascular system, which is of 30,000 series, and cardiovascular system usually starts from 30,000 series is not only cardio, 30,000 series is like divided into two. One is respiratory system and the other one is cardiovascular system. So in that it starts 30,000 series starts from respiratory system from 30,000 to 32999. That is respiratory system, and the remaining from 33010 it starts from cardiovascular series till the end of 30,000 series. Okay. So today let's discuss few guidelines from that. Anyway, you will get questions, 6 questions out of 30,000 series, which will be combined of respiratory as well as cardiovascular. Okay, you can expect 3 questions from respiratory and 3 questions from cardiovascular. Mostly it's like that. Anyway, let's move to the questions and let's discuss few guidelines as well in between. Friends, hope my videos are useful and please share it among your friends. So moving to first question. A physician performs a 4-vessel autogenous, 4-vessel, that is 1 venous and 3 arterial, coronary bypass on a patient who had a previous CABG, coronary artery bypass grafting. Okay, so who had a previous CABG 2 years ago, utilizing the saphenous vein, radial artery and the left and right internal mammary arteries. Select the CPT codes for this procedure. Okay. So, here, what is the question? The physician performs 4-vessel autogenous coronary bypass. So, 4, which means 1 is venous and 3 is arterial. 1 venous by grafting and 3 arterial graft. That is what we need to code here. Okay. So, you need to code according to the, there's a sequence for coding. And here there is a saphenous vein mentioned. So, utilizing the saphenous vein. So, saphenous vein grafting is there and radial artery and left and right internal mammary arteries. So, it means it is mentioned in the question initially that it is 1 venous and 3 arterial. So, this 1 venous means that is saphenous vein and the remaining 3 arterial is 1 radial artery and then left and right internal mammary artery. So, like that 3 arteries, 3 arterial graft. So, in total of 4 grafting. Okay, so you have to code the procedure. So, since there is 3 arterial graft and 1 vein, saphenous vein. So, which will be the primary code? It should be the arterial because it is more, right? 3 arterial graft. So, that you have to code first. Anyway, let's move to the codes, the options. The first option, first code 33535. I'm already into cardiovascular page. So, you can open your CPT code book and go to cardiovascular. Please take 33535. 33535 is coronary artery bypass using arterial graft. 3 coronary arterial graft. So, 3 arterial graft you have to code it first. Yes, as I mentioned you, this is the code. 3 coronary arterial graft. So, this code is important and this should be the first code. So, if you check the options, you can eliminate options B and C because 3 coronary arterial graft should be the first code. If you check option B, 33534, even that code itself is wrong, right? What is 33534? 2 coronary arterial graft. 33534 is 2 coronary arterial graft. We have 3, so that is wrong. And if you check option C, 33533, which is a single arterial graft code. So that is also wrong. So you can directly skip options B and C. So we have now remaining options A and D only. Okay. So first code is same, 33535. Now, what is second code in option A? 33510. Let's find out if 33510 or in option D 33517 is correct. You have to code for saphenous code now. Anyway, And then what is 33510? 33510 is coronary artery bypass, vein only, single coronary venous graft. We need single coronary venous graft, but vein only is mentioned. If you check 33517, the second code in option D, coronary artery bypass using venous graft and arterial graft. Single vein graft in addition to primary procedure. Yes, 33517 is the add-on code, single vein graft, which is in addition to the primary procedure. Yeah, in addition to coronary arterial graft, we are adding one venous grafting is also there, right? So single vein graft. So that is important. So if you code for the vein graft, it will be, the description will be like this: coronary artery bypass using venous graft and arterial graft. But we already mentioned arterial graft. So single vein graft. The single vein graft is the remaining one. So you have to code 33517. If you check the option, the bracket down, it's mentioned use 33517 in conjunction with 33533 to 33536. Yes, in that our code is there, 33535. So this is the additional add-on code that you need to add, 33517. So definitely your answer will be option D. Still, let's look into the other two codes. What is 33530? 33530 is a reoperation coronary artery bypass procedure or valve procedure more than 1 month after the original operation. Yes, here it's mentioned this patient was having a previous CABG to surgery 2 years ago. So if it is after 1 month, more than 1 month, you have to code it separately, reoperation. Yes, since this was 2 years ago, the reoperation is carried out after 2 years, so you have to definitely code this code also, 33530. Okay, and 35600, the last code. What is 35600? 35600 is harvest of upper extremity artery, one segment for coronary artery bypass procedure. Harvest of upper extremity artery, one segment. Yes, this is one segment, upper extremity artery, which is the radial artery, right? So that also you have to code. Harvest of like femoropopliteal vein, something like that you will be getting, femoropopliteal vein or harvesting of artery, upper extremity, lower extremity artery, whatever it is, that you have to code it in addition to the other two codes. Okay, so this is how the CABG procedure, the CABG, coronary artery grafting has to be coded. Okay, if it is one vein and 3 arteries, definitely you have to code for 3 arteries first. Code the additional as add-on code as the venous code, the venous grafting as an add-on code. Then if it is a check if it is a reoperation code or no. Like if it is more if the patient is doing this for the second time and if it is more than 1 month, you have to code for the reoperation code, and then check if it is an upper extremity. If there is any upper extremity artery, you have to code it also. So that will be the sequencing. Okay. So as I told you, answer will be option D, 33535 for the 3 artery code, 33517 for the venous code, 33530 for the reoperation, and 35600 for the harvesting of upper extremity vein. Artery. Okay. Now moving to the second question. Second question. A patient presents to the hospital for a cardiovascular spectrum study. A single study is performed under stress but without quantification with a wall motion study and ejection fraction. Select the CPT code for this procedure. See here, although it is belong to cardiovascular system, but the question is to code for this procedure. What procedure is carried out? The spectrum study, the cardiovascular spectrum study. So which will be in the radiology chapter. So the radiology code you have to code here. Okay. So let's go directly to the option. The first code 78451. What is 78451? You have to code for cardiovascular, spectrum study. 78451. Myocardial perfusion imaging tomographic, SPECT. It's also called as SPECT. Okay, myocardial perfusion imaging tomographic, including attenuation, correction, qualitative or quantitative wall motion, ejection fraction by first pass or gated technique, additional quantification when performed, single study. Yes, this is a single study. Same SPECT study. You have to code 78451 is required. Myocardial perfusion imaging. Yes, myocardial because cardiovascular. Yeah, so myocardial perfusion imaging. SPECT study, that is the short form. Okay, tomographic SPECT study. Now, what is 78472 as mentioned in option A itself? An additional code 78472. 78472. Is it really required or not? 78472 is cardiac blood pool imaging, gated equilibrium. Planar single study, not required. There is nothing mentioned about blood pool imaging. No. That code is wrong. So you can skip options A and B. What is 78453? 78453 is myocardial perfusion imaging, planar. This is planar. Myocardial perfusion imaging, planar. 78451 is myocardial perfusion imaging, tomographic. That is SPECT study. That's what we require. So you can skip even option C. So the correct answer is option D, 78451. Okay, it's a single code. The single code question, myocardial perfusion imaging, tomographic, SPECT study. It's specifically mentioned in the description of 78451. So no need to look for the other codes. So answer is option D. Okay. Let's go back to question 3. Sorry, let's go to question 3 and let's go back to 30,000 series again. In the cath lab, from a right femoral artery axis, the following procedures are performed. Catheter placed in the left renal accessory renal superior to the left renal and one main right renal artery. Radiologic supervision and imaging is performed in all locations. What CPT codes are reported? So, catheter is placed. Catheter placement is the procedure carried out here. So, you have to code only for the catheter placement. Rest is just, it is mentioned how it is placed or where it is placed. Okay. Left renal, accessory renal, superior to the left renal and one main right renal artery. So, you have to code only for that catheter placement. Anyway, let's check the options. What is the first one? And also radiologic supervision imaging is carried out in all locations. So, you have to identify from the option whether we need to report radiological code separately or not, apart from the CPT code. Okay. Let's go to the first option, first code 36252. What is 36252? 36252, in option A, 36252 and 36251, both are mentioned. So, let's find out what it is. 36251 is selective catheter placement, first order, main renal artery and any accessory renal artery for renal angiography. See, angiography is mentioned, so it means radiological code is included in this code, okay, including arterial puncture and catheter placement. Fluoroscopy is also mentioned. Contrast injection image, post-processing, permanent recording of images and radiological supervision and interpretation. See, mentioned radiological supervision and interpretation. So, angiography, fluoroscopy, radiological supervision and interpretation, everything is done. Everything is included in the code, including pressure gradient measurements when performed and flush aortogram when performed unilateral, and 36252 code for bilateral. You can't code it both together, right? Unilateral and bilateral together, it's mentioned in option A. So, option A is wrong. We have in our question it is, two. One is in the left renal and other in the right renal artery. So, bilateral. Of course, 36252 is our code. And if you check the options B and C, there is no 36252 mentioned. What is 36245? 36245 is mentioned in options B and C. What is it? What is that 36245? Let's check that also. 36245 is selective catheter placement arterial system, each first order. So, first order left, first order right, all these are mentioned in option B and C. In option B, left, right separately with adding modifiers. In one way that is also correct, but if you have a combined code, combination code, definitely you have to code only that one. So 36252 should be the correct one. If you check option C, again the same code 36245 and it's marked with 59 modifier, which is not correct. So the correct answer here is option D, 36252. Bilateral code, selective catheter placement for the bilateral code, which includes angiography, fluoroscopy, radiological supervision and interpretation, everything is there. Okay, so option D, 36252. Moving to fourth question. A physician states he performed a comprehensive EP study with induction of arrhythmia in the hospital. The report shows bundle of his recording, pacing and recording of the right atrium and induction of arrhythmia by electrical pacing. What CPT codes are reported? So comprehensive EP, electrical pacing study. EP means electrical pacing. Okay. So physician here is performing the comprehensive pacing study, electrical pacing study with induction of arrhythmia. Induction of arrhythmia. Okay. And report shows the bundle of his recording. So here, in this question also, since this is related to cardiovascular, but this is something which is coming under medicine chapter, right? 9.3. Let's go to medicine and cardiovascular chapter. Okay. 9.3, 600. The first option. What is first option? First code. 9.3, 600. So what is 9.3, 600? The first code. 9.3, 600 is what is 9.3, 600? Yeah, bundle of his recording. Okay, the report shows bundle of his recording, pacing and recording of the right atrium. So everything you have to code. Okay. So because all these procedures are carried out, right? So you have to code. The first one is bundle of his recording. You have to find the code, which is 9.3, 600. Since the physician itself is carrying out the procedure, you have to mark it with modifier 26 to mark it as a professional component. Okay. Now what is 93602? Intra-arterial recording. Yeah, recording of right atrium, it is mentioned. Intra-arterial recording. 93602. Again, mark it with 26 modifier. What is 93610? Intra-arterial pacing. Yes, pacing is mentioned. Mark it with modifier 26. And 93618. Induction of arrhythmia by electrical pacing. Induction. Yeah, induction of arrhythmia. That is also mentioned in the question. So, what are the codes that we have to record, mark it here? In the question, it is mentioned the report shows bundle of his recording, pacing, recording of right atrium, and induction of arrhythmia by electrical pacing. 4. So all these 4 you have to definitely code it. So code all the 4 CPT codes and mark it with modifier 26 to show that it's the same professional component. It's mentioned in the question, right? Physician states that he performed all these procedures. So since the physician itself is carrying out the procedure, mark it with 26 modifier. Okay. If you check options B, C and D, only one code is mentioned, which is wrong. You have to code for all the 4 procedures. And if you check all these codes in the CPT code book, down in the bracket it is mentioned, do not report 93602 or do not report 93600 along with 93619. All these are mentioned that you have to check it. Okay. If there is anything coming out as in the option, but it's not there. So A is the correct option, correct answer. Okay. All 4 procedure you have to code it. Mark it with 26 modifier. Okay. Moving to 5th question. A physician supervises a patient during a cardiac stress test performed at the hospital and writes the interpretation and report. Which codes are reported for the physician employed by the hospital? So here, what is the procedure carried out? Cardiac stress test. Okay, cardiac stress test. The procedure carried out here. So and the physician has done the cardiac stress test and writes the interpretation report. So what will be the codes reported? Okay, let's go to options one by one. What is the first code? 93015. 930. Yes, 93015. So you have to code for the cardiac stress test. So 93015 is cardiovascular stress test using maximal or submaximal treadmill or bicycle exercise, continuous electrocardiographic monitoring, and or pharmacological stress with supervision, interpretation and report. Yes, cardiovascular stress test with interpretation and report. Everything is mentioned. If you go to option B, 93016, that is supervision only without interpretation and report. But in our question, it is clearly mentioned the physician also has a written interpretation and report. So skip option B. Again, option C and D has 93016. But along with that, what is 93018, 93017? What it is? 93017 tracing only without interpretation and report. Again, it is wrong. And 93018 is interpretation and report only. So it means here, along with supervision, interpretation and report is coded separately in option D, which is wrong. If there is a, as I told you before, if there is a combination code, always use that code. Because here, the cardiac stress test procedure along with interpretation and report is mentioned in option in the first code 93015. So that is the correct one. So the answer here is option A, 93015. Okay, cardiovascular stress test using maximal or submaximal treadmill or bicycle exercise, whatever it is. Then with supervision, interpretation and report, everything is mentioned. All right. So that's it for today, friends. These are few important questions from cardiovascular series, cardiovascular system. Not only 30,000, whatever which is related to cardiovascular, it is mentioned here. So you will be getting almost 3 questions from this session. Okay. So that's it, friends. Thank you so much. Hope you like the video. If you have any queries, please mark it in the comments. And thank you so much for supporting me. Those who are new to the channel, please subscribe and stay tuned for more videos. Thank you so much. Bye. Take care.